Avery is a twin who was born at 25 weeks and 6 days. On day 3 of life, he had a grade 4 bilateral brain hemorrhage, which resulted in his hydrocephalus. Our journey with hydrocephalus started with spinal taps, went to a reservoir, and eventually what he has now, a VP shunt. As far as education goes, most of our education came from our nursing staff. We were really lucky to have a good rapport with them and just to feel like we could come to them with anything and ask them any questions that we had. At Duke, as well as other hospitals, you'll find that they have a family-centered approach or a team-oriented approach to their care for patients. And as a parent, we feel like our nurse is our team captain or our first line of defense. She's the person that we go to try and figure out information or to gather information and to kind of weed through what the providers are saying. The medical language and medical terminology is very scary and very foreign to someone who doesn't have a medical background, and our nurses really kind of helped us to understand what they were talking about during rounds, as well as to educate us on what things were going to look like and what things were going to feel like with Avery. For instance, his hydrocephalus was pretty bad, and his skull had kind of expanded to kind of let that pressure move and to let that fluid move. So whenever you would go to pick him up or to adjust him, if you felt the back of his head, it kind of felt like a gel pack. It was very malleable. Your fingers would kind of go into the fluid, and just having our nurses there to reassure us that that was normal for Avery and that it was okay. It was really empowering, and it gave us the ability to kind of feel more connected, not as scared, and to really understand what was going on with him. As far as information regarding shunt failures and malfunctions, we mainly got that kind of information from our neurosurgeon after we got out of the ICN. I think because we were dealing with so much while we were in the ICN, that really wasn't what we were being educated on. It was kind of the here and now is what we were being educated on with our nursing staff while we were in the hospital. And then with follow-ups, then our neurosurgeon and his staff kind of educated us on those things. As far as what parents need from their nursing staff, we need honesty. We need to kind of know what's going on. It's a very scary situation, and to just have somebody there who has seen these things before, it really helps us to feel more confident in what we're doing as first-time parents, or at least first-time parents of a child with a major brain injury. I would say what we need from you is just guidance. It's going to be a long journey, and just to have somebody get you started off on the right foot with good education and feeling confident about taking care of your child is going to help you make it through that journey.